Here's a sentence that sounds impossible. A man got bitten by one of the most venomous snakes in the world, spent days in the hospital, and survived. 5 years later, he brushed his leg against a twig in a park, just a tiny scrape, and collapsed to the ground in agony, certain he'd been bitten again. He hadn't. It was a scratch, but the pain in his leg was as real, as intense, and as undeniable as the day the snake actually got him. That man is Dr. Lorimer Moseley, one of the world's leading pain researchers. And his own body proved the very thing his career was built on. Pain doesn't always mean damage. Sometimes, pain is a message from a brain that has learned wrongly that you're in danger. Now imagine that happening not for 2 weeks after a scrape, but for 2, 5, 20 years in your back, your neck, your stomach, your head. Millions of people live exactly that story every single day. They've had every scan, every pill, every injection, every surgery, and they still hurt. Not because their pain is fake, not because it's all in their head, but because their nervous system has learned a pattern it doesn't know how to unlearn. That's the subject of today's book, Unlearn Your Pain by Dr. Howard Schubiner, a physician who spent over 3 decades treating what he calls mind-body syndrome. Real, physical, often excruciating pain caused not by injury or disease, but by the brain itself. And more importantly, a pain that can be reversed. Let's get into it. Chapter 1. The Truth About Your Pain. Schubiner opens with a promise most doctors would never make. Your pain is real, there is a reason for it, and in most cases there is a cure. Not management, a cure. Here's the science behind that promise. Pain begins when nerve pathways between the brain and body are fired. Fire them often enough, and like a hiking trail worn into a hillside, they become wired, a default route the brain reaches for again and again. This is neuroplasticity. The same brain flexibility that lets you learn a language or a golf swing can also learn pain. And the same flexibility that built that pathway can unbuild it. Think about a broken arm. It hurts terribly for a few weeks, and then the pain disappears as the bone heals. So why does back pain, or whiplash, or fibromyalgia sometimes last for years, long after any tissue has healed? Schubiner's answer: because pain isn't purely a body signal. It's a brain decision shaped by stress, fear, and unresolved emotion, which keeps a pathway on long after the original injury is gone. Chapter 2. Medicine's Blind Spot. Chapter 2 is where the book gets genuinely startling, because Schubiner turns his own profession's evidence against itself. Take whiplash. A Norwegian researcher named Schrader compared car accident victims in Norway, where doctors prescribe rest and neck collars, to Lithuania, where doctors just tell you to go back to work. Result: chronic whiplash pain was essentially non-existent in Lithuania, even in people with 0 seatbelts and totaled cars. Meanwhile, demolition derby drivers, people who crash for a living, sometimes over 150 times, almost never develop chronic neck pain. Why? Because they love what they do. There's no fear attached to the impact. Back pain tells the same story. Take 100 people with back pain and 100 without, run MRIs on all of them, and doctors literally cannot tell which group is which from the images alone. Up to 90% of pain-free adults have abnormal findings, bulging discs, degenerative changes on their scans. These are normal signs of aging, not the source of pain. Yet once a patient is told they have a bad back, the label itself often makes the pain worse and more chronic. Similarly damning. Studies show back surgery outcomes are worse in regions with higher surgery rates, and narcotics can actually increase nerve sensitization over time, making pain worse, not better. Schubiner's conclusion isn't that doctors are careless. It's that modern medicine is trained to hunt for tissue damage. When there isn't any, most doctors have nowhere left to look. That blind spot is the reason this book exists. Chapters 3 and 4. How pain develops, brain, and mind. So if it isn't tissue damage, what is it? This is the neuroscience core of the book. Your brain contains a salience network, essentially a danger detection system built around the amygdala and a region called the anterior cingulate cortex, or ACC. When the ACC fires, pain gets amplified. When a different region, the dorsolateral prefrontal cortex, or DLPFC, activates, pain gets dialed down. Chronic pain, in Schubiner's model, is largely a tug-of-war between these two areas, and stress, fear, and old emotional wounds keep tipping the scale toward the ACC. Here's the wild part. Brain scans show that real pain, hypnotically suggested pain, and even pain from believing you're in danger all light up nearly identical pain circuitry. Your brain doesn't just process danger. In a very real sense, it manufactures the experience of it. Timothy Noakes' research on marathon runners hitting the wall found the same mechanism. It's not that the muscles physically fail, it's the subconscious brain sounding a false alarm to protect you from a danger that isn't really there. Chapter 4 brings in the psychological layer. An estimated 95% of our thoughts and reactions are subconscious. We consciously process about 40 bits of information per second out of the roughly 11 million bits flooding into our brains. That subconscious mind is running the show, and it can choose, without asking you, to express stress as physical pain instead of as a feeling. Schubiner introduces a memorable internal family metaphor borrowed from Freud. An internal child driven by raw needs and emotions, and an internal parent, your conscience, driven by guilt, duty, and the need to be good. When these two are in conflict, when you feel obligated to keep smiling while you're secretly furious, exhausted, or trapped, that unresolved tension has to go somewhere. Often it goes into the body. He shares the case of a firefighter named Barry, injured on the job the same day a colleague died in the fire. His neck pain lingered for 9 months, resistant to every treatment, until Schubiner helped him see that the pain wasn't really about the accident. It was about buried fear, anger, and guilt over his friend's death. Once addressed, Barry was back at work in 6 weeks. Chapter 5. Do you have mind-body syndrome? This chapter is essentially a diagnostic toolkit, and Schubiner gives readers a simple framework to self-assess, which he calls FIT. Functional. Does the pain make no structural sense? Does it appear symmetrically on both sides of the body, or spread with no injury? Inconsistent. Does it shift location, worsen with stress rather than activity, or vanish on vacation? Triggered. Does it flare around anticipated stress, like before a doctor's visit, or even just from imagining a painful movement? If even one of these fits, Schubiner says, that's often enough evidence to seriously consider mind-body syndrome. He walks readers through building an emotional history, questions about childhood, parents, siblings, and stressful events, because the goal isn't just diagnosis, it's connecting the dots between when the pain started and what was actually happening in that person's life at the time. Once patients can honestly say, I have mind-body syndrome, he says they've already taken the hardest and most important step toward recovery. Chapters 6 through 10, the 28-day program. The back half of the book is the actual treatment, a 4-week program built around what Schubiner calls the 6 R's. Reading about MBS, repudiating the false physical diagnosis, writing exercises, reflecting through meditation, reprogramming the brain, and rebuilding your life. A later edition is verbal emotional expression, drawing on a therapy method called ISTDP. Week 1 is about building emotional worksheets, mapping out past stressors, and for each one, naming the anger, guilt, grief, and love tangled up in it. Patients also learn reprogramming techniques, talking directly to the brain, calmly telling it there's no danger, the way you'd silence a smoke alarm you know is a false alarm rather than an actual fire. Week 2, Reclaiming the Past, goes deeper into guilt and shame, two of the most common emotional engines behind MBS, and introduces unsent letters as a tool for releasing feelings toward people the patient may never actually confront. Week 3 uses structured dialogues, essentially guided conversations with yourself, to process buried anger and grief. Schubiner shares a moving transcript with a man named Ed, who finally lets himself feel and express decades of suppressed anger and guilt toward his daughter. And 1 week later, his chronic back pain is 90% improved. Week 4, Creating the New You, shifts from processing the past to building the future, identifying personality traits, perfectionism, people-pleasing, difficulty saying no, that quietly feed the stress-pain cycle, and practicing self-compassion and self-acceptance in their place. Throughout, one line recurs like a mantra: stop measuring success by whether the pain is gone today. Measure it by whether you did the exercises, whether you're moving your body again, whether you're living your life. Schubiner calls this outcome independence because chasing pain-free days too anxiously can, ironically, keep the alarm system switched on. Chapter 11. Next steps. Not everyone heals in exactly 4 weeks, and Schubiner is refreshingly honest about that. For some people, full recovery takes up to a year of consistent work. The most common thing that stalls progress, he says, is lingering doubt. That quiet voice saying, "But what if it really is my back?" Certainty, he argues, is not optional. It's the fuel the whole process runs on. He encourages readers who feel stuck to revisit possible hidden barriers, subconscious reasons the mind might, in a strange way, prefer to hang onto the symptom, and, when needed, to take real action in their lives. A hard conversation with a parent, a boundary with a sibling, even the end of a relationship that's quietly been the actual source of the pain. Chapter 12. Frequently asked questions. The book closes by answering the doubts every skeptical reader is thinking. What about genetic conditions like migraines or fibromyalgia? Genes only account for 15 to 40% of risk. The rest is triggered by life circumstances and can be turned off again through this kind of epigenetic style change. Do I need to believe in this for it to work? Belief helps, but Schubiner insists this isn't the placebo effect. It's addressing an actual mechanism. Even skeptics recover as long as they stay open enough to test it. Should I stop my medication or physical therapy? No, keep them, and taper off medication later with your doctor, once the pain has actually improved. What about autoimmune diseases like asthma or rheumatoid arthritis? Schubiner is careful here. These involve real tissue damage and require real medical treatment. MBS methods might reduce flare-ups, but they aren't a cure for genuine structural disease. This is an important, honest boundary the book draws around its own claims. The results Schubiner reports from his own clinical research are striking. In one fibromyalgia study, roughly half of patients cut their pain scores by 50% or more within 6 months, after years, sometimes decades, of suffering. Not from a new drug, from understanding why the pain existed in the first place. The core idea of Unlearn Your Pain boils down to something almost deceptively simple. Your brain learned to create this pain to protect you from something. Stress, fear, buried emotion, the same way it learned to ride a bike or flinch from a hot stove. And anything the brain has learned, the brain can unlearn. If there's one line to take away from this whole book, it might be this: pain isn't the enemy. It's a message. And once you finally understand what it's been trying to tell you, you can thank it and turn it off. If this summary resonated with you, the full book goes much deeper into the exercises, the case studies, and the science behind each one. And if you've dealt with pain that never quite made sense to your doctors, this might be worth reading in full. Thanks for watching. See you in the next one.